Welcome to the Healthy Relationships Initiative podcast. Our goal is to provide information and tools to help you build happier, healthier, and safer relationships of all kinds. To learn more about HRI, please visit www.guilfordhri.org and check us out on social media at GuilfordHRI.
Hi, everyone, and welcome to today's Healthy Relationships Initiative Relationship Booster. We're glad that you're here with us today. My name is Christine Murray. I'm the director of the Healthy Relationships Initiative, as well as the director of the UNC Greensboro Center for Youth, Family, and Community Partnerships. As you know, this program is put on by the Healthy Relationships Initiative. The Healthy Relationships Initiative is a partnership between UNC Greensboro and the Phillips Foundation, and our mission is to promote happy, healthy, and safe relationships of all kinds in Guilford County and beyond. And we invite you to check out our website at guilfordhri.org, as well as find us on social media at guilfordhri. Just a few kind of housekeeping details to go through before we get started. First of all, we do invite you to share questions through the chat room. And the best way to do that is to send your question to our moderator for today, who's Camila Dos Santos. And she will save up the questions, and we'll try to get to as many of those as we can. So please feel free to share those throughout the program. And also, before we sign off at the end of the program today, Camila will be sharing in the chat room a link to our feedback form, and it's really helpful if you could just take a few minutes to share your reactions to our program today, so we use that to help improve our programs in the future. Our topic for today's program is maintaining healthy relationships while undergoing cancer treatment. And we're very thankful today to have our guest expert with us today is Dr. Allie Forte. So Allie, if you could just share, well, first of all, welcome and thank you for being here. We're so grateful that you took the time to be part of this program. Could you go ahead and share a little bit about your background and maybe especially your experience related to this particular topic?
Well, and thank you for inviting me. And I am currently an assistant teaching professor at Wake Forest University, and I have worked within the cancer world since about 2007. So I have done contract work with Cone Health Cancer Center and worked with them on creating Finding Your New Normal, which is a 6 to 8 weeks, depending on how it runs, post-treatment wellness program for cancer survivors. And I've also led groups on meaning-centered psychotherapy for patients with chronic cancer, and I've done general support groups, and I also lead retreats for, it's been mainly for breast cancer patients, but we've recently opened it up to cancer of any type. So that's pretty much my background. I also completed a postdoctoral psychosocial oncology fellowship at Wake Forest Baptist Health.
Oh, wow. So you've got a lot of great experiences today that I'm sure have helped to kind of inform the topics that we'll be talking about today. So thanks for sharing that background. And we'll go ahead and just jump right into our topic. So we usually start with just a real overview of the topic. So with our topic being maintaining healthy relationships throughout cancer treatment, could you share what you see as some of the most significant relationship and family challenges that happen once someone's been diagnosed with cancer, and then as well as while they go through the treatment process?
I think one of the most significant things that helps or happens to either couples or families is this idea of role change. So when someone's been diagnosed with cancer, inevitably there's going to be either surgery or some adjuvant treatment, chemotherapy or radiation involved, and more, potentially. And so while a person is going through that, they experience fatigue or pain or some type of physical change, dealing with side effects. And so when you think about them experiencing all those physical changes, it also impacts their roles. And so this can put a real strain on a relationship or a family because, for example, if mom with 3 kids is diagnosed with cancer and she's the one who typically takes care of most of the things in the household and work, but she's undergoing treatment, all of a sudden her partner or her kids have to begin to shift their roles to compensate for her role changing. And so then that kind of leads into also people sometimes struggling with their identity as they're going through this. And so So I would say just role changes, either within the family or the couple, or also to roles within work relationships as well. That tends to change when somebody is going through cancer treatment. But I would say, okay, so but roles and identity, those are two biggies. Other things that couples experience too is changes in intimacy and connection. That's a big one, where when somebody's going through treatment, you may think that intimacy is the last thing anybody wants to think about, and maybe when you're talking about sexual intimacy, but they still want some kind of close intimacy, but that can be really challenging for a couple to manage during treatment and even post-treatment as well. So I would say that is another one. And then I think another strain that couples or families experience is how best to help their loved one going through cancer. And that, I think that one, most people would think, oh, well, you just help them, you're just there for them, you just support them. But it's much more complicated than that. I think when somebody is, it depends on their diagnosis, but if somebody's facing a poor prognosis, or even if their prognosis is not that poor, but they're experiencing more worry and shock and feelings of uncertainty, and they want to talk about it, a lot of loved ones will sometimes cheerlead and say, nope, you're going to be fine, we've got this, and so it leaves the person going through cancer treatment maybe feeling less connected to their partner and more isolated, and so that can be a real challenge for families and couples.
And it seems like, especially in that real immediate point after the diagnosis, but even as treatment continues, because that can be a very difficult journey as well, but it seems like a lot of times people, I'm sure they sort of understand that this is going to be a major physical health thing, probably bring up a lot of existential issues, but just from hearing you talk about these challenges, it seems like a lot of those relationship issues are probably not things that people expect or really are very prepared for. How does that kind of hit people sort of as a surprise?
I would say yes, and actually I was just reading recently, just out of my own curiosity and kind of in preparation for us talking, about relationship strain and divorce rates while somebody's going through cancer. And what I read was that in one study, 21% of women who are going through, there's a patient, the identified patient going through cancer treatment, end up getting divorced, whereas 3% of couples get divorced if it's the man going through treatment. And that really stood out to me, when you think about the surprise of a couple kind of facing this together. And I think it has a lot to do with role changes and existential issues that it brings up. And so, nobody is prepared to be diagnosed with cancer. I think it comes as a shock for everyone. And so I think people are surprised by how they react, and any underlying issue in a relationship, the heat and the stress that the cancer brings into that relationship is going to accentuate what's already there. So if somebody's beginning to think about any level of unsatisfaction or dissatisfaction in their relationship, cancer is only going to highlight that. Or the other ways, I think sometimes this is what I'll see, is it brings two people closer together. So it can kind of go both ways, but cancer certainly is a stressor that the relationship faces.
I'm glad you brought that up, because I was just thinking that too, that it seems like probably the quality of the relationship or the health of those relationships before the diagnosis would play a role, because like you said, that's a major strain to place on a relationship. So if there are already some cracks or some problems in the relationship that either they've already been working on, or sometimes, in relationships, people just try to kind of push on through and don't work on it necessarily. So it seems like it would really potentially magnify issues that were happening beforehand. But then also, like you said, I think sometimes when people are faced with something like a major health diagnosis, it puts other things in perspective. So it's interesting to think about how that can impact people. And I wonder, just one more sort of question or point on this to hear your thoughts on is what happens when people are kind of on different pages about it, because it could be one person is sort of, willing to work on it or willing to kind of focus more on strengthening the relationship, and then others, maybe it leads more to resentment. So how do you see that playing a role, especially with couples?
Right. So I think, this is a really challenging area because I've seen it go both ways, where the cancer puts such a strain and the couple is not on the same page. And then you have somebody going through cancer treatment while also beginning the unraveling of their relationship in some ways. Mm-hmm. And so that, of course, and that's usually why I would end up seeing them. So that's very difficult if they're not on the same page. And I think that tends to happen, I think, more quickly if that's going to happen, because from the get-go, most cancer treatment requires a lot of the loved one at first. And the pace that the experience or the process asks a couple to adjust is so fast, mm-hmm. and for some it's long. And so then you get into that, the couple, or especially the loved one or the caregiver, can get a little burnt out over that time. Mm-hmm. And so if the caregiver or the loved one is not on the same page as the person going through the treatment, that is certainly a challenge where the relationship is at risk of ending or being non-supportive or not healing. And I think, when somebody's going through a cancer process, it's such a scary and isolating experience that you want your partner to be there, to be your rock, and to be some sense of healing, because certainly you're going through the actual treatment, which might heal physically, but there's a lot of emotional and spiritual healing that also occurs along the way, and coping. And I've seen it where it can be, it can go, if it's okay to say, beautifully, where the couple really does unite and support each other. But for those times where the couple's on opposite ends of the spectrum, I think that adds to how difficult the cancer process is.
Yeah, that makes a lot of sense. And so let's talk a little bit more. We'll come back to a lot of these relationship issues, but let's talk a little bit, because I think it's helpful to understand kind of what it's like for somebody to receive a cancer diagnosis. And I know that it can look very different, but could you just sort of help us to understand what are some of the common experiences for people as they adjust to a cancer diagnosis and begin treatment? And then we'll put that back in the relationship context.
Yeah. So there's almost a developmental process, I think, that people go through when they get diagnosed. And from the get-go, when they first hear you have cancer, I think shock and fear and uncertainty arise. And then it goes into one of two paths. Either things happen very quickly, you jump right into surgery or some type of treatment, or the opposite, you actually have, and when I say jump right in, I mean they might say, we've got you down for Friday, and you just learned you have cancer, and you don't even have time to process that you have cancer, and you're going into surgery. And so it can happen just like that, or they tell you, we can't squeeze you in for 2 or 3 more weeks, and then you're left sitting there thinking, I've got this tumor or these cells that are out of control, and and most people will go through their head, I'm getting sicker, or this is getting potentially more lethal, and so it creates a lot of anxiety in somebody. So, but that's the initial diagnosis, and then a person begins to learn, wait a minute, I'm not in control here. The medical system that we have currently is one where it is, I think it's challenging for people to have their voice or be their own agent in their healing. And not to say it's impossible, but if the medical system wants patients to kind of just go through their protocol. And so I'll see people who struggle with that, of just the helplessness or vulnerability that comes with being a patient in the medical system. And because cancer treatment requires so many appointments and treatments in general, or surgeries, you're in that role usually for a while, and there's a lot involved in that role. And so a sense of helplessness or vulnerability can also come in to play. And then that leads to also more thinking of mortality, more thinking about priorities. Certainly in those the first part of cancer, and this depends on their prognosis because sometimes this then becomes chronic, people are in survivor mentality where they just want to put their heads down. I'll think about my existential crisis later. Let me just survive this. Let me get through my 30 radiation treatments or my 6 rounds of chemo, and then I'll come up for air and figure out what's happening. And so, so you'll see somebody sometimes just power through, and then they'll finish, come up for air, and begin to wonder what just happened. And then for that person where it ends there, where they, the cancer is treated and the likelihood of a recurrence is low, and then they'll process from that point. But then others will have to go through that cycle over and over and over. And that's when treatment, for some even, becomes chronic or lifelong. They may never, some people, especially with lung cancer, that will be something that they just continue to do. So that's part of the process as well. And all throughout the process, a person is managing side effects. So from the second they start going through this process, they're not the same. There's almost a before cancer and after cancer identity and experience in life. It's hard to look at life the same way. And so, so I think that comes with then its own set of physical issues, emotional and spiritual issues as well.
So if somebody's going through all of those different things, I can definitely see just how their perspective on relationships would really change. And I think it's very common when you go through something difficult, whether it's a health issue, a major sort of crisis or trauma in your life, that you start to look at relationships kind of differently, and maybe are starting to really recognize kind of who's really in your corner and who's not. So could you speak for a minute about how somebody's perspective on relationships in general, but also maybe specifically kind of how they experience individual relationships too?
So I frequently heard you find out who your friends are when you are going through a health crisis. And so cancer in particular, and well, it used to be with cancer that it was, people would even call it a C word because there was such a stigma around cancer that people couldn't even say the word. And I would say our culture has shifted a little bit more towards acceptance or understanding or compassion or less fear of cancer, but not that much. It's still a health crisis that is different than other health crises. And so I think people don't always know what to say to somebody who's been diagnosed with cancer. And so rather than create awkwardness or make themselves feel uncomfortable or worry about making the other person, the person with cancer, feel uncomfortable, they'll retreat. And so that is extremely hurtful to people who are going through cancer. And so they'll, that's when they'll say, you really find out who your friends are because you notice that people start to pull away. Now, the opposite also happens. You start to realize, oh, wow, we're closer than I thought. Somebody really steps up. And so, there is a shift in how somebody would think about relationships because I think they look for relationships to be more meaningful and more genuine, and so when they see people step up or push away, it provides a sense of clarity of what they want in a relationship. And that could be for friends, for coworkers, and family members as well.
And I think that's a really important point to make sure that we kind of focus on for just an extra second about for people, if they're going through cancer treatment, diagnosis, or even after treatment has been done and afterward, just to kind of normalize that is something that's common, and you shouldn't necessarily feel guilty if you find yourself feeling like you need to set new boundaries with friends or some people. I think also I would say maybe the importance of grieving the losses of certain friendships, but then also being grateful for having those stronger friendships, maybe that do the people that step up, really focusing your energy on those, and then also understand that that's normal if you have people who do not step up, and just let yourself be okay with that, because I think sometimes people can get very disappointed by that, and it is very disappointing, but also to kind of grieve that in a healthy way. Do you have any other thoughts on that?
Yeah, Yeah, I think, it's disappointing for, if you really imagine how scary it is to go through cancer, it's that, I think that level of grief when you're disappointed in a relationship, I mean, it just cuts to a really visceral way, because this is a time in your life where you need somebody, or you really want people to rally around you. And so I think the level of grief that somebody experiences when they realize this relationship wasn't what I thought, or that person that I felt connected to isn't there for me, and maybe they can't, maybe they just don't have their own level of coping, or who knows why. But I think it's a profound loss. And what I have seen is that once people begin to realize, okay, this is part of the process, that I am going to see relationships fade away, or I'm going to see relationships enhance. Once they can accept that and understand that it's not them, it is actually part of the cancer journey in some ways, I do think it makes it easier, especially if their journey becomes longer, to move forward with a sense of empowerment of how they want to move forward with their relationships and what type of boundaries they want to set in their relationships.
And let's, I think at a real sort of practical level, it might be helpful to talk for a minute about how we know for a lot of people that they don't reach out because they don't know what to say. Like you said, they're afraid to offend the person. They're, afraid they might say the wrong thing. And we'll talk about what loved ones can do and, kind of that. But how can somebody who is feeling that disappointment in friends who are maybe backing away, but maybe assuming the best intention, that maybe it's not because they don't want to be there for them, but they're scared or they're afraid. What could somebody facing cancer treatment, the diagnosis, the journey, say? Like, how do they kind of advocate for their needs and maybe reach out and open invitations? Sometimes people just need to be cut out, but then other times I think it might be that they could speak up and say some things to people close to them and just say, don't worry about saying the wrong thing, or if you say the wrong thing, if you hurt me, I'm going to let you know, but I know that you're my friend and that's important to me. So I don't know, I just think advocating, how can they maybe sort of advocate for themselves or feel okay with speaking up for themselves?
I really like that question, and I'm going to answer it backwards a little bit.
That's fine.
I think first, because when I was listening to your question, my first thought was for the people who back away. I almost want to speak to them, first, and then to the person who's going through cancer, because I do think one important thing related to relationships and cancer is that in some level, I think just from what I've seen, it seems like the people who are not the ones going through cancer, I almost think it's the responsibility, because they're not the one who's sick and not feeling well and doing the best they can to survive. It is, and it's a time, you think about this level of fatigue, the level of nausea that people experience. Advocating for yourself in those moments and reaching out really is hard.
Yeah.
You're in survival mode. And so I would speak to the people who want to back away because they don't know what to say. And I would say, I would encourage those people to be vulnerable and to talk with their other friends, talk with other people about why it is they feel the need to avoid their friend or their loved one in need. And I would encourage them to do some processing. And if they're not willing to go through that for themselves, then I would speak to the person going through cancer and say, that probably wasn't a healthy relationship potentially, or a fulfilling or genuine relationship. That if they can't be there when you're in need and aren't willing to go through their own process to grow and be there for you, that's something to consider. But it is, I think it's hard to be an advocate while you're going through treatment, because where they will focus, where patients will focus more, is advocating. They're so far outside of their comfort zone.
Right.
So when I think about advocating for themselves or finding their voice or agency, I think you need to do that with the medical profession, sometimes over the friends, because you can only ask a person to stretch themselves so much at a given time under these circumstances. And, when I'm working with people, that's where I really push to find your voice. It's to speak up and have a say related to your treatment and what's going on in the medical world. And so when I think about then friends falling away or family falling away, I think, gosh, that's a lot on a person.
Yeah.
So I would focus more on the people who stayed and are really there for you.
And that could be a piece too, and it could be not full level sort of advocating, but just sort of trying to say, here's what would be helpful, or don't worry about saying the wrong thing, or I'll tell you, but it could be small things. But what you just said made me really think that maybe work with, if there is somebody that's really stepped up and really been supportive, like talk to that person about these other relationships, and maybe that other person can help you navigate some of those relationships, especially if it's extended family or a group of friends, and maybe only one person out of a group is really stepping up, and the other people are either hurting you or offending you. Maybe talking to the people who are there and focusing that energy on them, but maybe that's the way that they can help you, is by advocating in that way. I read a great book recently. Maybe Camilla can try to find it and put it in the chat room, but it was called There's No Card for This, or something, or No Good Card for This. I think it was a yellow book. It had like pictures in it too, but it was about this very topic, about how people really struggle, and so a lot of times rather than try to help how they can, they back up and they pull away. It was actually written by, I think one of them is a therapist. I apologize, I can't think of the name right now, but I think one of them was a therapist and the other was a greeting card writer.
Oh, wow.
And so it's just a really good book, but it said that people can help in a lot of different ways, but you shouldn't let your fear stop you from trying, like at least to try and for people to really think through, like, what can I do? And maybe that is what we can shift in a little bit about kind of the experiences around the loved ones, but that seems like a really tangible thing for people to consider. If you have a loved one who is facing cancer, that, you may want to be the person who brings the meal, and maybe you are a terrible cook. And so, being okay with what you can contribute and the types of support that you can offer, and trying to offer those things and trying to help in the ways that you feel comfortable. So let's talk a little bit more about that, though, too, because I think people struggle with what to do. That kind of gets to that picture of like, man, I would love to make a fresh casserole and bring it over, but I don't know how to cook a casserole, so I shouldn't do anything, right? So, what is it like for people who want to help, maybe aren't sure how they can, and, how can they step into maybe some of that discomfort?
Here's what I have heard from so many people who are going through cancer. I just want to know they're there. And so when you think about it that way, that it almost doesn't matter what you do, just don't back away. So even if you just bring over peanut butter and jelly, it's just the gesture that says, I'm here. So if somebody can just think about it, almost just show up, I would say. That would be my biggest piece of advice, is show up, and I want to give credit to Richard McClellan. He used to say this all the time when I was working at the Baptist Cancer Center, and he would say, listen carefully and respond thoughtfully. So I would say just show up and just listen. So even if you don't know what to do, just by being there and not saying anything, but just saying, let's watch a movie, let's watch the sunset, or just whatever it is that two friends do together or family members do together, because it really is going to depend how that cancer patient feels at the time. But I would say just show up and listen are the two biggest things, because I think friends typically put so much pressure on themselves that it makes them want to just retreat and fade into the background. And I would encourage them to think less about it being perfect or doing the right thing or the wrong thing, and just showing your presence in some way. And so cards, sending cards, sending books, offering to, not waiting for the person going through cancer to say, will you help me? For example, a lot of people going through cancer will say, people always tell me, just ask me for help or tell me what you need. But somebody going through cancer doesn't always know, and that puts a lot of pressure on them to know what it is that they need, to receive help. And so I would also say don't wait to be asked to do something, but just jump in there and say, I'm just going to mow your grass, or I'm just going to come over and I'm going to do your laundry and then I'm going to go. You just can take your nap, and I'm just going to do this. Or drop off a basket of food, and but don't stay. But it just let them know that you love them, you're thinking about them, and you're there for them by these gestures. And so I think by just jumping in, that allows your loved one going through cancer to know that you're there, and it takes a little bit of the pressure off of what am I going to say, or am I in some ways doing something that I'm offending my loved one?
Yeah, that's such a good point, because I think it's important for people to remember that for a lot of people, it is very difficult to ask for help.
Yes.
And I think we're all kind of in this culture socialized to be like, we can do it ourselves, we don't need any help, very independent. There's definitely, maybe not everybody's socialized in that way, but a lot of people, that's a mindset that is very common in our country. And so when you find yourself in a vulnerable position, you say, oh, do you need any help? No, whereas really you could benefit from someone coming and just doing a load of laundry or just bringing food, and they may not be up for staying, or they might love to have someone come and visit. And I think your points about listening are just so important, because I think people think they have to figure it out, like, oh, I need to figure this perfect thing that would be the magic thing that would make them feel cared for or supportive, or this one great way to help. But really, I think the more you listen to somebody who's going through something, you can start to hear things like if they start to say, man, I haven't mowed my grass in the last month, or, my neighbors are complaining about this, or, or whatever it may be. And really just trying to think about low effort ways for the other person. So like you said, dropping off some food, maybe in a way that they don't even have to necessarily be there, or a gift certificate for a restaurant that has delivery service, or, just really simple ways. But I do want to go back to the just listening. When we're doing these relationship boosters, and through a lot of our work with the Healthy Relationships Initiative, we like to make it really, really practical. And I think that we shouldn't just assume that everybody knows kind of what to say. So even just at a really practical level, what could somebody say, well, tell me how you're feeling. Even, can you think of any other really nice kind of invitational openings for people to be able to listen, to get somebody talking?
So I really like that point, because it is just listen really is not enough in some ways. And so so it's kind of two things. I would want everybody to know, who is the loved one or the caregiver, so not the person going through cancer, that sometimes when a person is going through cancer, sometimes, and I'm sure we can all understand this, you're going to have good days and bad days. And so I would say first is accept that as you are vulnerable, and move in to just listen, and I'll give you some suggestions on how to work that in a second. Also be prepared for potentially your loved one to snap back, or be a little grouchy, because there's just good days and bad days. And so so I think just also kind of put that in as a context that comes with the cancer process. And and this is where I think it's tricky. When a loved one wants to start the conversation, I think asking, sometimes people going through cancer don't want to be asked how they're feeling. They get burdened by that, especially maybe if they're just wherever they are in their journey. And so so it is in some ways taking a risk for the loved one to say, how are you feeling? But I do think that is a way to start. I think just checking in and just saying, hey, I'm just doing a check-in today. How are you? Something like that. And you'll be able to tell from their response that this is day that they want to talk, or maybe this is the day where they don't want to talk. And so when you say, hey, I'm just checking in, and you can do that with, you can call them on the phone, you can text them, you can, if you're dropping off food, you can say, I can stay if you want me to, or I can go, what kind of day are you having? And that would be some place to start. What kind of day are you having? Because it's going to vary. So, but I would do check-ins, or I would, if I think knowing about where they are in their cancer journey, just staying abreast of what in their life, in the medical world, and in the logistics of everyday life, what's going on. I think just inviting even simple conversations about, so what round of chemo are you on? How many left? How did radiation go? So asking them questions about how things went. I think when people are going through cancer, because that topic is so hard for people to talk about, people don't ask about those things. And so, so then, I encourage people going through cancer to go to a support group because they talk so openly about those things. So for all the loved ones, I would say ask about how medical treatment is going. Ask how things are. Ask them questions about their experiences with little logistical things like parking. How's the parking going? But just try to help them explore or let them know you want to know what it's like going through this. So that would be one of my practical tips: is ask about the logistics of what's going on in their medical experience. Do check-ins. Be prepared for good days and bad days. And keep trying. So no matter what your loved one going through cancer gets back to you, hang in there and try to be the container for any emotions that they're going through. Because in some ways that's what support is. It's holding that emotion for them.
I think too. I wonder. Correct me if I'm wrong on this, but I wonder if too. I love all your suggestions, and I wonder if there's also a place for sometimes saying, if you've always talked about like the latest reality TV show with that friend, to say, I'm here to talk about whatever you want. Like, do you want to talk about how things are going with your cancer treatment, or do you want to talk about The Bachelor? And like, because people sometimes, I think when they're going through things also, it might be the kind of day where you need extra support around the challenging things that you're going through, and it might just be a day when you want to feel like you've always been before that happened. So I don't know, any thoughts on that? I mean, just kind of giving options too, to say, oh yeah, and that almost opens the invitation too to give options like, yeah, this is a day to talk about this, or it could just give them kind of a range of things that you're there to talk about.
Oh, Christine, you nailed it. I think that is spot on, and so many patients have said that. Like, I just am so sick of cancer. And I'll hear, oh, just if anybody buys me one more pink thing, it's that they get very, sick of it. So you're right, and I think as the loved one or the friend or family member, it's kind of testing it, checking in. Is that a day to talk about it or not talk about it? And this is where I really think it's hard, and this is what makes relationships and cancer so unique, is you don't know what kind of day that person is having or what space they're in. I love it. Is it a reality TV day, or is it a cancer day? Or a
leave me alone kind of day, and I'll ask you again tomorrow, but that's such a good point that it can change. And even, I would think some days it's not even just the whole day, but it's like, this time of day I'm one thing, this time later, 2 hours later I'm feeling differently, 2 hours after that I'm feeling differently, and it can be, I mean, it's a great point around the everyday, and I just imagine too, like a lot of times, especially early on or around major key points in the treatment process, that it could be even hour to hour, what the person needs is very different. So okay, good. We've got some time left, because I've got a few kind of sort of burning questions that I'm sitting with that really aren't on our list of questions that we shared, but this is a little bit of a sensitive topic, but going along with the experiences for the loved ones. So I'm just managing conflict that can come up, and let's say, especially we're talking about maybe a couple, and a couple who you know, maybe there are some challenges that have come up through the cancer experience, whether it's maybe resentment over these changing roles or changing identity, or even just typical couple types of conflict, like who's going to take the trash out. And I would think, correct me if I'm wrong on this too, but I would think that when you're going through something like cancer treatment, there might be a tendency to really avoid conflict and say, well, you know, I'm really resenting, you know, my partner or my friend or whoever it is, I'm really resenting them, but I don't want to say anything, you know, and so to some extent then that could be something that could build up towards somebody then really withdrawing. Or, I mean, we know this as counselors that if you're not kind of processing conflict and navigating it in a healthy way, eventually something's going to be the breaking point and it's going to explode into a really serious fight. So what suggestions do you have for navigating conflict issues, especially in the midst of all the other sensitive issues that are coming up?
This is a tough one. I love this question. It's important because inevitably cancer does not make conflict go away, and it definitely heats up the potential for conflict, I think, to be more powerful in a relationship because it's such a stressor. So here's my thinking around conflict. First of all, don't avoid conflict, but also don't go looking for it. So I typically, so I'm obviously a counselor and a proponent of counseling, but I also don't think counseling is the cure or the solution for everything. That's kind of just my thinking around counseling. However, when it comes to the cancer experience, I'm a real proponent for everybody getting a counselor, the person going through cancer and the loved one, you know, in particular the intimate partner, or whoever the closest person is that is on the journey who might have the most conflict with the person going through cancer. So one of the reasons I really push for getting a counselor for those people involved is because at first you need a lot of support around managing conflict. And some of the things, conflict, I think, can be resolved in some ways by processing it first with somebody external. So you can de-escalate some of the emotion around the conflict so that when you bring it up, which you should ultimately with each other and work it through. But I think you know, it depends where a person is going through cancer, but you've also got to do, your timing has to be so important. You really don't want to bring up those things around conflict, like the nitpicky daily living things that come up, like who empties the trash. When somebody is going through cancer, it's hard, it really is hard to have the energy to fight about that kind of stuff. And so sometimes when a person is going through cancer, especially if they're living in mortal time or they know that their prognosis maybe that they have, they're told you'll probably have 2 or 3 years. If you're in that position, people will say they'll get very irritated or annoyed at what other people will consider problems or conflict. And so I would say to the loved one that understand that your partner may not be looking at things the same way that you're looking at things. That the things that bother you may seem less important or irrelevant to your partner. And so I would say first understand that their worldview has shifted potentially. And so also that's where I think counseling comes into play is helping decide, is this the type of conflict that's worth bringing up? And if it's the minutia of everyday life, you may want to just think about is that worth it? So that's one thing I would think about.
Or even just real quick to jump in, especially before we move to maybe bigger issues, but around the kind of like you called it, the minutia of everyday life. Maybe instead of viewing it as conflict, maybe approaching those conversations like we've got a like the trash needs to be taken out, my work schedule and my caregiving is really difficult. How can we work together to sort this through? So not approaching it as like, a conflict issue so much as this is a problem, let's talk through our solutions. You know, it might be saying, you know, is there anybody that's offered to help you in the neighborhood that might be willing to come over like once a week to help with some basic like cleaning of the house or something like that. So to still possibly address those issues, not to totally not, but to think through how you're addressing them. And then, like you said, before addressing them, I'm sure a lot of those types of issues could just be like, this is probably something to drop. But not to let them just acute, but to, for the loved one to do something about it, to sort of process it. Because I think a lot of times when people carry things around, then they're not releasing it. So it might be talking, like you said, with the counselor. It might be having a problem-solving conversation, or it might be some sort of internal way of saying, okay, well, this is bothering me, but I'm going to intentionally drop it. I'm frustrated by it, but I'm going to intentionally kind of process that emotion rather than let it well up inside.
That's it. And I think this is, I wish I had more to offer in some way right now, because what I keep thinking of is it really just depends so much of whether or not you choose to bring up the conflict. Depends on what's going on for that person going through cancer. So if you know, if they're having an inpatient stay, that is probably not the time to bring up conflict.
Right.
But if they're having what I would just refer to as a good day, they're having a good day, that would be the time to bring it up. So if that's kind of where your partner is in this, and assess would they be able to receive whatever the issue is. Because what I do see happen, and what we know happens, is that when loved ones or caregivers don't bring up conflict, or they avoid conflict, it does create distance, and overall it's not healthy for the relationship. Sometimes people will find it helpful to have couples counseling for this, so because there is a lot of pressure on the caregiver and the loved one to avoid conflict. They feel guilty. They feel like somebody might be judging them if they express their needs. So if a loved one says, you know, I'm just really burned out and tired, but everybody will say I'm selfish, or how can I think that or say that because my partner has cancer? So I do think they have to approach conflict, but I do think the timing of it is important. Deciding whether or not you want to do this in counseling, or diffuse some of the emotions around it with your own counselor before you bring it up. But doing relational check-ins is important throughout all of it. So, and every couple is going to be a little different here, but even broaching the subject and having a plan of, okay, you know, so somebody's been diagnosed, they've gotten through, they're kind of in the rhythm of their treatment. Most people begin to learn, and they'll say things like, okay, I know after chemo I'm going to start to feel sick around this time, or whatever. I know I'm going to feel tired around this time. So they find kind of a rhythm to their treatment. And so a part of that I would recommend is ahead of time come up and have that preemptive conversation with your partner of how are we going to handle conflict while I go through this? You know, what are the boundaries? What are the rules? How are we as a couple going to do this? Because everybody's going to need a little bit of a different strategy. And so I think just even having the conversation about conflict before there is conflict can help, because both people are really in new territory here. Right. And there's no, when it comes to cancer, there's not necessarily any really good options sometimes. That's saying you're choosing bad option A or bad option B because it's not a place where people want to be. Right. And so coming up with your own relational ground rules around how you're going to navigate this, I think would be helpful.
I think that's a great point, and being proactive is a really good idea. Obviously, there's differences when if you're already kind of in the midst of it or anything, but if we have any professionals who are listening to this, who work with people in the kind of initial diagnosis phase, or people who are listening who might be in that point, to sit down and have that conversation up front and say, even if it's 30 days of radiation, to say, we know over the course of 30 days we're going to have some kind of conflict that's going to come up, especially with everything that's going on. So let's not wait till it comes up, but let's try to talk about it ahead of time, and maybe we come up with some ideas for ways we can bring things up. I could almost even envision a creative idea like a little suggestion box that they have at businesses sometimes, where you can kind of drop your suggestions in, and then when it's a good day and a good time to bring it up, we'll visit it. That way we know that it's going to be discussed. And then also for people who may be already in the process and maybe have experienced some conflict, to know that you can kind of turn around and learn from that. So if you've had moments where it's already been challenging, to have a conversation about, okay, what can we learn from this, and what might we want to do differently in navigating conflict. And I know that's a difficult topic. Do we have any questions that have come in, since we've only got about 10 minutes left? Okay. So let's, since we're coming to the last 10 or so minutes, what do you think, based on kind of all we've talked about, what are some of the most important things that people can do as big picture sort of takeaway points about how to keep healthy, strong relationships during cancer journey?
Okay, so one of them I think is just really basic and practical, but be compassionate towards yourself and towards your loved one.
Mm-hmm.
I think that is, even when I first got involved with working with people with cancer, I did my dissertation where I remember talking about this with my chair. I said, something I'm just noticing, just clinically noticing, is how self-critical or how hard people are on themselves. Mm-hmm. I heard so many people in groups or in the post-treatment group just being critical of, gosh, I wish I could be a better mom. I wish that I could be a better wife, or I used to do this for my husband and now I can't, or especially around intimacy issues, they would feel guilty of, I'm not in the mood, I just don't want to, and I know my husband is feeling distant, but they would be so hard on themselves. And I just thought, gosh, you've just been through a lot. It's okay to I think acknowledge that. And so for starters, I would think big picture is be compassionate towards yourself and towards your partner. Mm-hmm. So I would say, big picture, be compassionate, be mindful of what it is that you're experiencing. I think the more mindfulness a person brings to their own experience, the healthier then their relationship can be. So be aware that in that aspect, keep communication open. I think that one is a really important one, because cancer brings up issues around identity, mortality, roles, meaning in life. If you have two people in a relationship who are having their own internal process as they go through that, and they might not be growing in the same direction, that could put a relationship at risk. So I would say just communicate really openly about what it is that you're going through, mm-hmm. and try to use that as a way to grow together versus grow apart. Mm-hmm. So be aware that those things happen, and that genuineness in your own experience is really important. Other things, let's see that for the big picture. I would say for either the patient or the survivor or their loved ones, I think support groups for something like cancer are so valuable, mm-hmm. because it really truly is a unique experience for both parties. And I think meeting people who actually understand what you're going through on both ends, the loved one or the person who went through it, I think that is healing, and it makes it easier for relationships to stay healthy. It's easier to have compassion for your partner if you know other people are going through the same thing with their partners. Or and I've heard it on both ends, because I've done caregiver support groups where they said the people in the group will bond and connect over that universality, that they don't always like their spouse, maybe, mm-hmm. or they get mad at their spouse and they don't want to say it to anybody else. And it feels feels so good to just kind of get it out there and know that it's understood and okay. And then I'll see in the group with the cancer patient support group where they'll say, my spouse does this or my partner does that, and that feeling. So I think support groups are really important for people to seek out when they're going.
So really finding safe places where you can talk through things, process your emotions, feel connected and validated in your own experiences, and then being proactive, I think, with keeping your relationship strong and realizing the importance of that, especially like we've been talking about this whole hour about how many challenges there are, that the strain and the pressure that it really puts on relationships. And so, we know that if someone's walking through this journey, there's so much that they're dealing with that the relationships may seem like, well, they're just going to be there, it's just going to sort of come along. But really, I think seeing that the more that they can sort of even just think of small ways, like, it may not be like 3-hour conversations every day, but maybe it's a 10-minute check-in or, just sitting and coming up with some parameters or some general guidelines about, if you're feeling upset about something, how can I bring this up to you, or when would be good times, or, ways that we want to handle those discussions. So just having that really more proactive approach in navigating relationships too is really important.
Well, and I thought about another one as you were talking, because this one comes up a lot. You mentioned earlier how hard it is for people to ask for help. And I think asking for help with the practicalities of life, the cleaning, the lawn, the oil changes, those kind of things. But also, too, for anybody going through a more chronic cancer diagnosis, bringing in teams of people who manage the bills and help track bills takes a lot of the pressure off of the couple or the relationship. And so I think, my advice or tip in this would be is look for ways to outsource some of the tasks that just are necessities in life, so that your relationship can have a little bit of the strain that is inevitable with the cancer process lifted, and take a little of the pressure off of your relationship.
And it might even be helpful to sit down and almost draw a map of who can we ask to help for certain things. Who's off the map because they're not stepping up to the plate, but either individually for somebody to do that, or either with their partner or a really close friend that is showing their real commitment to being there beside them, and then sort of mapping that out. Who could we ask to help with this? Who could we ask to help for this? And then, just having that sort of intentional approach, because everybody needs support, and especially when you're going through something really difficult like this, the cancer treatment and the journey. So I know that we're coming to the end of our time. So Allie, do you have any sort of final thoughts or big picture takeaways that you would like to make sure that people walk away with?
I would just want to encourage people to reach out and seek help. So all of the cancer centers, so this is people probably who are listening to this are all in the region, I would imagine.
Or anywhere.
So then here's what I would say is look in your community at, find either your regional hospital or your main academic hospital. Most hospitals have now cancer patient support programs. They're growing, and they're still somewhat understaffed or underfunded, but most places are creating these. And I would look for the resources of for counseling, for support groups, for services, that there are services available to help take the load off of families and couples. So I would encourage people going through this to seek out those services. And I think they're underutilized, and they're growing and available. So contact, I think, your local hospital.
Yeah, that's a great kind of finishing thought, because it can be such an overwhelming process. So don't be afraid, or don't feel ashamed to ask for that help or reach out, because there's a lot of helpful resources that typically are available for people. And it can take a little time and effort, and maybe even feel overwhelming reaching out for help, but it might be a couple weeks from that point or a month or so from that point, that once you have that help, it makes life easier as you're going through it. There might be some initial challenges in getting it all into place, but once you do, it helps to navigate that. So.
Yes, and I didn't emphasize this enough. Tell me if we are running out of time. But I also think, so for post-treatment, one thing that I noticed with couples, this might not be a summary, I don't know if I should bring this up, but I do see within couples, sometimes loved ones or family want the person who's gone through cancer to quickly bounce back, and they want life to be normal. And I would just want to have everybody kind of think about that this process is longer than when the medical treatment goes. So there is still a post-treatment that goes on with reclaiming identity, reclaiming who are we as a couple, who am I as an individual. And so just also know that when treatment ends, doesn't mean the cancer journey ends.
That's a great point. I'm glad you brought that up, because it is something that definitely can alter the course of people's lives altogether and impact relationships as well too. So, well, I really want to thank you for all the insights that you shared today. I think we talked about a lot of things that will be very helpful for people as they're facing this journey and really thinking about how can they keep their relationships as healthy as possible. So thanks again for being here.
Oh, thank you.
And we are very thankful for all of you for being here as well. And Camilla will, or it looks like she already has, posted the link to the feedback form. So before you sign off, please take a few minutes to fill that out. And our next Relationship Booster will be Friday, October 4th, and that day we'll be talking about the topic of technology and couple relationships. So we hope you'll join us, and we hope that what we discussed today is helpful information to help you have healthier relationships. Thank you.